Morning, everyone. Thanks for joining us. I see we have more participants than last time I saw you all, so thanks for being here. We are very much excited to see you all and share with you this morning. I'm going to turn it over to Jessica Rose Wallace, Director of Government Affairs here at Metropolitan Family Services, to get us started.
Wonderful. Good morning, everyone. Can you all hear me?
Yes.
Okay, wonderful. Just want to make sure my sound is working correctly. Good morning and welcome to Metropolitan Family Services 2022 Legislative Roundtable. Metropolitan Family Services has helped Chicago families meet hardships of poverty, epidemics, natural disasters, world wars, and economic downturns since 1857. Metropolitan continues to expand, reaching 136,675 children and families over the last year. Today, we'll be discussing the community perspective on the status of behavioral health and domestic violence services. Our goal is to discuss how we can meet community and workforce demands for safe and thriving communities. I'd like to recognize our wonderful legislators who are here with us today. We have Representative Mpowered, we have Peters, we have Representative Curlin, we have Representative Voci, we have Representative Point, who is a staff member to Jessica. We have Representative Young Moore, who's with us today, Representative Zardi, who's a staff member, Alexis, to participate with us, and lastly, we have Representative Hirschauer, who will be joining us today to listen to this riveting discussion between our staff, clients, who discuss the services that we provide. And I'd also like to recognize the staff who will be participating today. We will have Nikki Cameron, our Director of DUPAGE, Executive Director of DUPAGE, who will be joining us. We have our Director of DV Services, Amy Milligan, who will be joining us as well. From our Southeast Center, we will be having our Executive Director, Vanessa Schwartz, who will be providing some words from our Southwest site. We will be hearing from Katie Rise, and I believe there is one more staff member that I may be. And Rosemary, there you are. We will be joining us as well, a host of clients who will be introduced very shortly. I'm going to turn it over to Anne, who is our Government Affairs Policy Associate, who will be introducing the next segment of our roundtable.
Thanks, Jessica. We'd like to take a few minutes today to start our gathering to hear directly from those who've chosen to partner with Metropolitan Family Services as part of their journey. So join me in doing a brief video presentation to hear directly from Rochelle, Mace, and Julian.
The growth that I had as a person, because before meeting Jamie, I was content with living with my mom for the rest of my life. So this is the step I needed to take to be able to be ready for that when that time comes and I don't need her. With living in a CELA, that the support that the staff are able to give me, it's helping me become independent and like just to have somebody to talk to if I need somebody to talk to, because that's the most important thing sometimes, is just being able to talk to somebody. Jamie has supported me so much. Like if it wasn't for her, I would have had a mental shutdown a long time ago. Like, she got me through a lot of the situations that I've been through and I'm currently going through. And so, like, that without that and the support and the help from Dr. Blunt to give me my medication, just with such ease, it would have been hard if I wasn't involved with Metropolitan. It would have been extremely hard, and I don't know where I would be without it, but I would be happy.
I got into Katie, and the care she provided right off the bat was just insane, incredible, like nothing I ever experienced before. Because she was like, "We're gonna get you on medications right now because we don't want you to wind up in the hospital again. We don't want you to wind up in jail or anything like that." And I was like, "Wow!" I could see like the care right away was there, you know. So she had put me on antidepressants and antipsychotic medications right away, and I got scheduled to see Dr. Blunt right away. And ever since then, like, everything has gone skyrocketing. My life has improved like a 180. Like we're talking about right now. I went back to school. I'm going to school right now. My mental health is like at an all-time high. Mind you, it was an all-time low, now it's like an all-time high.
He is, I really truly feel like Mace is a testament or a testimony to what we truly do at Metro. And I know he gives us a lot of credit, but his desire to want to change his life and to make it for the better.
But she's showing me how what steps I needed to take to improve my life. All I had to do was follow the regimen, you know, follow the steps they provided me, and I'm going there now, you know. A lot of people that have mental health issues in this day and time. I've been in the system, so I've been in jail, prison, and a lot of people do not need to be there like me. Like, there's no way I should have been where I was at. But see, my mental health got me to the point where I resorted to things to self-medicate myself, you know? And a lot of people, I see the people in there, they were like, if they just got the right care, they wouldn't be in the situation they're at, you know? Yeah, and if people just receive the right services, you know, drug addiction will go down, you know, mental health. Such a big problem, you know, and there's solutions for it, you know. Counseling is like, it's absolutely something that people should attend to, you know.
And, you know, I know the court process took a really long time because of COVID, right? And so how did you feel when that was all finished and you were granted your long-term order of protection?
I was happy. And I felt like it worked out in my favor. I didn't feel like no one was picking and choosing sides because what I was going through and who I was and the situation. I just felt like you all took your time. You went through the process as you should. You all stayed in contact, you asked questions, you followed up. I felt good, and I still feel good to this day. Things are still going good. You know, I don't feel left out. I'm always put in the loop. And to get those phone calls, you know, from somebody so big, so much power to check on me. You know, I feel like I'm the only one in the world. That's how it makes me feel. It made me so good. It really, really do. Like, oh my God, they called and checked up on me this morning. So I'm grateful. I'm so grateful. I'm grateful. Yes. I was scared, and I realized if I don't do something, my family gonna be looking for me, and they're not gonna be able to protect me. You know, like, I had to think about that. You know, it's just me and my baby. I don't have no parents. I don't have no friends. We got too many family members. And I'm so happy that I had to gain a family through the situation I was going through.
It is hard not to smile when you see those faces and hear those stories. So we are proud of our domestic violence supports that have benefited Rochelle and so many others along their way. And we wanted to share a brief report with you about the current status of domestic violence services in Illinois, presented by our own Amy Milligan. Amy's a certified domestic violence professional who's worked with survivors of abuse for the past 26 years. In her current role as Domestic Violence Services Director at Metropolitan Family Services, she provides programmatic guidance and oversight for the survivor services we offer at community-based sites across Cook and DuPage counties. Pass it over to Amy.
Thank you so much. And thank you all so much for being here. I want to talk with you a little bit about the history of our funding in domestic violence services. In FY09, the state's budget for domestic violence services was $21.8 million. We didn't know it then, but that year would be the highest level the state's domestic violence budget would reach for more than a decade. In fiscal year 11, the appropriation for DV services decreased by more than $4.3 million. It regained a little over $1 million the following year, but has remained stagnant ever since. Small increases in FY20 and 21 did not get us back to our FY09 level. And if the governor's proposed budget goes through, the FY23 increase won't either. During these years, domestic violence programs have had to do more with less. This was never more true than during the FY16 state budget impasse, when DV agencies went over a year without payments on their state contracts. In order to keep providing the 24/7, 365 emergency services that our clients rely upon, many agencies cut positions at that time and decreased their non-crisis programming, such as prevention and community outreach. And statewide, many of those positions and programs have never been replaced, because while the DV appropriation plateaued, the cost of living and salary expectations have gone up. The demand for DV services remains high. Despite decreased funding levels in the 13 years since FY09, Illinois domestic violence agencies have continued to provide between 500,000 and 600,000 hours of service annually. Dedicated advocates, the majority of whom make less than $40,000 a year, have continued to provide safe shelter, 24-hour hotline support, assistance with orders of protection, counseling for survivors and their children, prevention, outreach, and connections to community services. During the pandemic, advocates have managed additional layers of crisis and complexity. Over the past 2 years, the domestic violence programs here at Metropolitan Family Services have seen a 30% increase in the average number of service hours per client. Advocates here and across the state learned how to provide services remotely, safety planned with victims who were suddenly trapped in their homes with few options. We distributed PPE to client families and drove food and supplies to the hotels where many victims were sheltered to prevent COVID outbreaks in our residential facilities. Domestic violence advocates are essential workers who provided life-saving services throughout the worst days of the pandemic. The stresses of the pandemic, layered on top of operating for many years with inadequate funding, have taken their toll on DV advocates across the state. Like most other sectors, we are experiencing the Great Resignation, and we are losing vitally important staff members who we are unable to replace. Candidates for open positions are asking for thousands of dollars per year. We are able to pay them, leaving positions unfilled and stretching our remaining staff perilously thin. Across the state, DV organizations are unable to sustain a living wage for their staff, let alone one that allows them to thrive. We're at a crisis point, and we must act if we want high-quality, round-the-clock domestic violence services to continue to be available to survivors and children. That's why the Illinois Coalition Against Domestic Violence has asked for an increase of $50 million for domestic violence services. The $400,100 proposed by the governor amounts to an increase of just $7,000 per agency. To provide some context, that's about $12 per survivor who called the state DV hotline in 2021, while the number of domestic violence homicides in Chicago doubled, and a single night of shelter costs $85. I'm grateful for this opportunity to speak with you and for your interest in and support of our services. On behalf of the domestic violence program staff here at Metropolitan Family Services, I thank you for being here today. And I ask that you support an increase in the DV appropriation that will allow us to continue our crucial work. Thank you.
Thank you, Amy, for that helpful report on the current status of domestic violence services in Illinois. My name is Vanessa Schwartz, and I'm the Executive Director of Metropolitan Southeast. Here at Metropolitan, we know that violence is not always physical, but takes many forms and is experienced at all levels. We are committed to preventing interpersonal and community violence in all its forms. Life is complicated and complex, so Metropolitan meets program participants with a range of wraparound services that help. We can address immediate needs such as housing and court advocacy, but also help our participants achieve holistic healing through job readiness, financial literacy assistance, substance use, and behavioral health services. At a community level, we foster partnerships that can impact social determinants of health, such as the partnership between the network and our CP4P violence prevention street outreach workers. Together, they explore the relationship between gender-based violence and community violence. When we equip our participants with services that empower them with healthy relationship skills, such as communication, effectively managing feelings, problem solving, and the ability to recognize their worth in our society, we are actively working towards eliminating violence in our communities. The Metropolitan provides opportunities to heal from trauma through case management, psychiatric evaluations, and crisis intervention. We are able to see the significant impact violence prevention programs have within our communities. One bright spot for many of our program participants is our behavioral health services. They provide longer-term supports for long-standing concerns and make psychiatric services available as needed. However, the availability of behavioral health services to meet these needs is also under threat due to staff vacancies, overly burdensome administrative requirements, and licensure limitations. We turn our attention now to hear about these issues from three of our talented frontline behavioral health staff members, Rosemarie, Katie, and Jessica, who will speak on behalf of Jamie, who's out today. Thank you.
Good morning. Thank you, Vanessa. My name is Rosemarie Obregon, and I'm the program manager for our crisis system of care here at Metropolitan. I currently work out of the Southwest Center. Like most behavioral health providers in Illinois, Metropolitan continues to experience an increased demand for behavioral health services while contending with unprecedented staff caseloads, mounting wait lists, and increasingly referred out lists due to workforce shortages. Part of the problem is an inability to hire or retain key behavioral health staff with Illinois' existing Medicaid rates. Illinois Medicaid rates are not enough to keep up with administrative costs associated with non-billable services, or what we as providers know to be the true cost of services. Medicaid rates also hold back providers like Metropolitan from being able to pay behavioral health professionals what they deserve so that we can recruit and retain our top-notch talent. The Rebuild Behavioral Health Workforce Act would create targeted funding for the most used community mental health services, leading to increased reimbursements for Metropolitan and other providers for years to come. This is federally matched funding and is widely supported in both chambers and by both parties. Your support for this legislation would help Metropolitan recruit and retain vital behavioral health professionals, and most importantly, expand availability of individual and family therapy. I want to thank you for your time and attention today and ask for your support for the powerful impact behavioral health services provide.
Good morning. Thank you, Rose. My name is Katie Reyes, and I am a clinical social worker at Metropolitan Family Services Southwest Center. As a behavioral health professional, I place the highest value on being able to develop trust and rapport with my clients so that we can develop a treatment plan that addresses their concerns and supports their well-being as soon as possible. As a practitioner at a community mental health center, I am required to complete an IMCANS assessment for each individual I meet with. As you may already know, in its current form, the IMCANS document is very intrusive and a pain point of service providers when first meeting clients and attempting to establish rapport. This document is slated to be completed in a maximum of 3 sessions and does not take into account situations when a client is highly symptomatic or experiences difficulty with communicating. In addition, it was created by someone with an expertise, it was not created by someone with an expertise in trauma or lifespan development. Therefore, we are calling for reform and to lessen potential barriers to clients accessing services. For those of you who have signed on as sponsors of HB 5333 and SB 3498, I want to thank you for your support. If you have not already signed on and support, I strongly encourage you to do so, and I'm happy to answer any questions you have. Thank you for coming today and your interest.
Hello, once again. I just want to ensure that you all can hear me clearly this time. Okay, awesome. So I will be reading a statement by one of our licensed clinical professional counselors from our Southeast Center, whose name is Jamie Rubio. He writes, "The community and people I serve are in high need for social services, specifically mental health services. However, currently, only licensed clinical social workers can provide and bill for services to individuals who have Medicare or Medicare/Medicaid dual eligible. Each year, the number of individuals with health coverage through Medicare and Medicaid increases. And each year, our agency's capacity to serve those individuals is stymied because only LCSWs can bill for services provided when someone has health insurance through Medicare. Allow me to explain. For individuals who have health insurance through Medicare or have dual eligibility for Medicare and Medicaid, only licensed clinical social workers can bill for services because Medicare is the primary insurance that processes the billing first and will not acknowledge and or reject a claim if the client was not seen by a licensed clinical social worker. This restriction has a devastating ripple effect. There is a dangerously high demand for LCSWs all across Chicagoland and a resulting shortage of LCSWs at Metropolitan Southeast Center and other community-based centers. Sector-wide workforce shortages mean community centers and, more importantly, families are shortchanged and left empty-handed. My agency, like other community service agencies, are now competing with private counseling firms and hospitals with bigger budgets that can offer more compensation. Metropolitan Southeast alone has lost an average of $100,000 plus for loss of reimbursement because of restrictive billing laws. We need your support in clearing these licensing hurdles. Specifically, we are asking your support in advocating with your congressional delegation in support of S 828 and HR 4432, the Mental Health Access Improvement Act, which is currently moving through Congress and gaining momentum. Next, I will turn it back to Ann Vanderwill, who will introduce the question and answer portion of our roundtable.
Thank you, Amy, Katie, Rosemary, and Jessica, on behalf of Jamie, for sharing your stories and your passion for the work that you do. You've presented us with some significant concerns, but also importantly left us with some ideas for creating change. And we'd now like to take some time to hear from our legislators or staff who legislators have shared time with us if they're not able to join us at this point. We'd love to hear your perspectives on these concerns and also the solutions. We'll start with a few questions that we've already prepared and move to an open question and answer period as time allows. So if you have questions for an open period, please add those in the chat and we'll do our best to get to those. If legislators and legislative guests, we are not expecting you to answer every single one of these questions, but so feel free to defer to a colleague if there's one that you're more interested in answering. But I'll now turn it over to Dr. Blunt, who's going to ask our first question.
Hello, my name is Dr. Blunt. I'm one of the psychiatrists here at Metropolitan Family Services. My question is, what work have you been involved with most recently to challenge the behavioral health workforce shortage within your districts?
Good morning, everyone. I'm State Representative Tara Costa-Howard of the 48th District. My district is solely in DuPage County, so I've done a lot of work with our DuPage County office. In terms of our workforce shortage in our district, one, I'm a co-sponsor of the legislation because I believe that these are issues that we have got to address. I think you made a great point in the sense of this is something that we've been struggling with for quite some time. But as I also serve on the Mental Health and Addiction Committee, we have repeatedly had it's probably one of the most bipartisan committees that we work with. And really, it's about raising the awareness and addressing the need, right? You all mentioned staffing shortages, and if we don't find and employ more qualified personnel, we're never going to catch up. We're never going to be able to meet the need. So those are some of the things that I'm working on, both at the committee level and the state level, but also, just trying to raise awareness within our communities.
Hi there, I'm Representative Yang Roar, and thank you so much for putting this together, for organizing this. I will have to apologize. I'm going to have to leave in about 3 minutes. But for my part, this is my first year in the legislature. Before that, I was with the school board. So a lot of my focus has been on student mental health, trying to address those needs, which I'm sure we know has been at crisis levels, similar to a lot of the things that we've talked about here today. I really appreciate you all kind of bringing up the legislation that you're focused on. Those are the ones I wrote them down, and I'll be adding my name to those. And to the extent that there are ways that you need our support. I know that everyone here we're friends of your organization and believe very strongly in the services you provide and the good work that you do.
Thank you for that, Representative Yang Roar, and also Representative Costa-Howard. We appreciate your advocacy on our behalf and your support for this legislation. I guess we would just add that in addition to signing on as co-sponsors, as you're in your various caucus meetings, that you would help elevate this and really champion this as priorities. That would be helpful to us as well. I know Mace has a question that he'd like to share with us.
Hello, yes, my name is Mace Sass, and I'm a patient of Dr. Blunt's and Dr. Reyes's. And my question is, how will today's event influence your actions moving forward to the mental health crisis?
Thank you. This is Representative Mizaki. I'll just jump in and say these types of events are obviously extremely important to us as legislators to ensure that we are made aware and we are, very in tune with the types of things that you're experiencing, particularly barriers to being able to provide services. I've been a big fan of actually reducing some of our licensing credentials in certain areas. And I've been on record that our Medicaid, Medicare rates are quite abysmal, and, identifying ways in which we can try to improve that. But unfortunately, those types of things are all going through the Medicaid, Medicare working group. So pretty much every piece of legislation that I've filed to try to get, to improve rates or things along those lines tends to get bottled up in various committees. What I would say, though, is that one of the things that I have been very concerned about, and this is an area where I think economic growth does come into play. Obviously, as our economy is not doing well, more people, wind up experiencing, more distress in their lives and need to seek out your services. One of the things that we do know is that Governor Pritzker had a $5 billion structural deficit last year. He was able to fill that in using federal coronavirus funds, but those funds are probably not going to be forthcoming this year. And I think that's one of the reasons why you're seeing a lot of the budget numbers that you are is because, you know, the money in Illinois is just not there, even at our current, you know, rates of economic activity. And even though we are going to be getting some, in theory, you know, higher revenue estimates as compared to the prior year. So I think that one of the things that would be great for all of us to also focus on is, you know, just trying to make sure that families don't even, you know, are less likely to even get into crisis in the first place. And that's an area where I would also hope that we could see some bipartisan support.
Ace, thank you for sharing your experiences. As a legislator, I can honestly say that when we hear from actual people, right, not just the people that live in our communities that we represent, but people from across the state, and how what we do in Springfield has such a direct impact on your life. One of the things that I think is important to talk about as well is how we as legislators use our personal experiences to help make decisions for what's going to happen and moving forward. I know Representative Mizaki made the comment about funding, because it's true. We have really struggled with funding and making decisions that are going to greatly impact everyone. I serve on the Human Services Appropriations Committee, so we hear a lot about what's going on and how our agencies have utilized those dollars. But you know, we talk about things at this really high level. So listening to individuals like yourself remind us that what we do actually directly impacts human beings, right? It's not, you know, bashing one another. It's actual people that we are responsible to take care of. So when you ask that question of how our experiences like today going to impact us, that's how. They're great reminders to us as legislators that we have a job to do, and that's to help the people of the state of Illinois.
Thank you.
Sorry about that. Thought I clicked it. Thank you for that encouragement and that back and forth. That you're exactly right, Representative Costa-Howard. That's the power of settings like this, and we appreciate you taking time to make yourself available to hear directly from those, even if they're not in your district. So thank you for that. I'd like to turn over to Tiara, who has a question about our domestic violence portion.
Hi, my name is Tiara, and I'm the Government Affairs intern at Metropolitan this school year. And this is kind of 2 in 1. So before today's roundtable, were you aware that the state of Illinois has not delivered an increased investment in survivors of domestic violence in 13 years? And the second part is, what was your initial reaction to this historical disinvestment, and how might you bring this to the attention of your colleagues moving forward?
So this is Senator Peters. I would just say that this is an issue for me, and I think that we need to boost funding, and I've made that clear to staff in the governor's office how I feel about the fact that we need to increase funding. What we've seen over through this pandemic has been a rise in domestic violence and assault. We've seen a rise in a whole host of areas of violence. And oftentimes our sort of solution to this is carceral, and that won't do jack shit for anybody, excuse my language. But I think fundamentally we just need to increase funding and increase y'all's capacity to do this work. And I also think it's often where politicians like to talk about how they care about victims, but it's really lip service to put on a piece of mail and not actual policy. It's an American tradition at this point. So it's for us to move away from lip service to actually putting the money and funding there. So.
Thank you, Senator Peters, for joining me. I was a little nervous I was going to be it after a while there, but I couldn't agree with him more, because I think one of the reasons I ran for office was in 2018 was because we went 736 days without a budget. That speaks volumes. We cannot go back to that. So it's super easy for people to stand here and say, we're going to do this and we're going to do that. And then when the budget comes to be presented to them, they vote no. It's complete lip service that they're actually willing to do something to make a change. We were shocked, to be honest with you. I couldn't believe that the budget address did not include DV. We talk about domestic violence all the time. We know we've got, and you all have provided to us that data that says, particularly during the pandemic, the rise in this is astronomical. Numbers that we didn't even really realize until people started coming out again from, under the executive order. So I find it incredulous that people would suggest that we shouldn't increase this. I can tell you that the Illinois House Democratic Women's Caucus has made domestic violence funding one of our priorities. And just little insider baseball for you all, as you may or may not know, but each of our caucuses has an opportunity to present priorities within the budget. And the Women's Caucus has been very consistent about, in particular, obviously, issues that directly impact women and children. Not that we as a Democratic caucus don't have those interests, in a holistic way, but we as women, these are issues that are important to us, and we do bring those forward. So I do know that DV was one of the priorities that we put forth for this year's budget cycle. But I cannot agree with Senator Peters more. I'll say it again. It's super easy for everybody to stand there and say they support these things and bash, the process and then vote no. No, that we don't have to like how everything is done, that we have an obligation to step up and hit the yes button.
I just want to jump in on behalf of Representative LaPointe. I very much agree with Representative Costa Howard and Senator Peters. I'm sure like everyone in this room has felt the increase in domestic violence cases in our constituent service work. And our legislation this year is reflecting that, but our budget isn't. And that's a disappointment for all of us. And I know, like Rep. Costa Howard said, the Women's Caucus is a big proponent of this, but as well as the Progressive Caucus. And I know that that's something that Representative LaPointe is keeping top of mind too. And it's making the priority as well. And I'll share the rest of the reflections that I've been sent with today to share with all of you where I can or in the chat. And thank you for having me.
Thank you, Jessica. We definitely will be sure to share her comments with those that are participating and those that we share this recording with as well. So thank you for that. And thank you, Representative Costa Howard and Senator Peters, for that reminder that this is a partnership, this is a relationship, and the conversation doesn't end here. And nor should the accountability. And so thank you for that reminder to follow up on looking into who is voting. We hope that we're securing the support, but it's helpful to know and make sure that we hold each other accountable for these actions. So thank you for that. I'm not seeing a whole lot of additional comments in the chat. So just a reminder, if you have any other questions that you'd like to pose, throw those in there and we'll try to put those forward. It looks like we are going to have some time for a little more back and forth. I have one that I'll pose while we wait. One is around this idea of intersectionality. I think in human services, it's very often that approaches get siloed into, this sort of work, behavioral health work or domestic violence work, et cetera, et cetera. But we all know that as humans, our lives are intersectional and we can't silo ourselves. And so I'm wondering if that is reflected in the work that you do in the General Assembly. I'm wondering if that idea is reflected among your colleagues, or if it still feels more of a siloed approach in the work that you're doing in the General Assembly.
I don't want to sound partisan, but the reality is we're those of us who are Democrats on this call, everything we do is intersectional, right? We believe that that's the way things, you're not just one or the other, you are a mix. And I don't mean to sound so partisan, but as Democrats, that's how we approach the work that we do. Unfortunately, I can't say that for everyone in the General Assembly, but I think that we can always do better, right? We can always do better in that approach. I made the comment about the Women's Caucus, and it's not only a women's issue, it's a humanity issue, and that we need to be able to address it and talk about it in that way. I I also would argue that, there are so many organizations that have focuses that are very siloed, right? And I'm just going to say Equality Illinois and they are wonderful partners with us, but their focus is one, is LGBTQ. And so I think that we all can do a better job of focusing on partnerships with other organizations when we bring things forward, because it is not just the responsibility of one organization. I have found in the last couple of years that I've been here, I really appreciate the coalitions that come together to work together on particular pieces of legislation. As you're talking about the mental health workforce, that does not just impact this group or that group. It really is more effective when you all work together within a coalition, because again, otherwise you are very siloed. And this is intersectionality. That's what it is that we do.
Yeah, very much so, Representative Costa-Howard, that, I'm just looking over the pieces that we sent to you ahead of time, the legislation that we've advocated for. And really all of those are in collaboration and in coalition with all of our mental health partners and, the domestic violence, the Illinois Coalition Against Domestic Violence. So very much moving forward in coalition with our partners. Are there any other questions? I don't want to hog all the time.
Well, can I just make a point? I know Senator Peters, I don't know if you want to jump in, but one of the things that I, from a pure advocacy standpoint, right? We, those of us who had the opportunity to join this call today, and we hear from you as organizations. Again, and I hear from you guys because you're DuPage County, you're actually right outside my district, your building, but as in my other life, and I'm an attorney who is a court-appointed guardian ad litem for children and families, I have worked with your organization for over 20 years. So I've actually seen your work in action. My point is, many of the people that work with all of you are voters. So when you're advocating, please don't just advocate as a member of Metropolitan Family Services. Remember, you're voters. You have a voice. You should be sending emails, please not just the form ones, to your individual, reps and senators. You have a voice as a constituent. I encourage you to use it. I find it very powerful when, I hear from somebody who works with your organization and they happen to be my constituent, because you're not just, you're providing that perspective. So please remind those who work with you on your teams to, individually advocate for these physicians as constituents as well.
I don't know how I'm going to one up that, but I agree completely. I know that I think Vanessa's on here, but I did we've done a few things pre-pandemic. We did when I do the Farm Bureau Adopt a Farm, and I brought them up, and I think we did a tour of the Metropolitan Family Services building over in the southeast side of the district to try to give folks at the to give the farmers downstate, they're going to show me some things. I thought that they should see the breadth of the district here, and Metropolitan Family Services played a big role with that when it comes to events and engagements. And I agree. I get form emails and form letters. You got to do them. That's a thing. But if you ever could take that step just a little bit more to that next level and personalize it a little bit more, it goes a long way in moving us and as well as moving the issue. And I think oftentimes, so I come from the organizing space, so I come from a community organizing space. And so I'm going to say this to a bunch of people in the C3 space. So this is not to be explicitly electoral, but to be about power. You actually have a whole lot of power from the people that you serve, to the work that you do, to the communities that you're engaged in. And if you don't use that power, and you don't see or realize that power. And yes, it's not power in terms of like you've got billionaire bucks coming out of, you know, everywhere, but it's in organizing. We always say that there's three things of power: organized people, organized money, and organized narrative. And one thing I'll say is that you have the ability to organize people and organize the narrative in a way that is so vitally important around these issues. And you kind of do it here by having us on and being able to pose us these questions, but to know that you have that, the best way to be able to exhibit that is in a personal touch, not always the form manner. So.
Well, you've given me a perfect segue to plug our advocacy task force here at Metropolitan, who actually is the sponsor of this event. Katie and Rosemary are active members, as is Liz Humsey, who's joined us. They're active members of our advocacy task force, which are staff members who have taken the time outside of their regular duties to help their colleagues and their clients and their family and friends to elevate these issues with them as well and become those voter voices that you are encouraging. So hats off to them for their work within us here internally. And we will certainly be pushing this out and that message out as we share this recording as well. Along those lines, I'd like to thank Senator Peters, who is my state senator. Thank you for coming. Thank you for your support. Just throw that in there as a voter voice. So thanks for coming today. Let's see, I'm just checking the chat. I don't see anything more, but Tiara has her hand raised. So let's turn it over to Tiara.
Hi again. It's not really a question so much as I guess it would be like encouragement or something, but I'm in a human rights course this semester and I love it. I rave about it all the time. And even in our discussion today, I'm hearing a lot about humanity and that we're more than like our party, but also we can't bash the process. We have to remember who you guys are doing the work for. And I think even in terms of like the domestic violence budget and also the mental health bills that are passing through, I think it's a good idea to maybe remember that whether you act on these or whether you don't, you could be contributing to violating human rights or working towards securing and advancing those human rights. So everyone, like no one should be subject to inhuman or degrading treatment or punishment. And when we don't act on that budget for our domestic violence, we're violating their rights and making it so they aren't feeling safe. And even with our behavioral health legislation, when we aren't supporting that or advocating it or doing whatever you need to do because you guys are fancy and cool, we are taking away that security from another person. And when we don't act on that, you know, we're just kind of doing weird things and we don't want to do weird things. Weird things as in violating human rights and being an oppressor, for clarification. But if you aren't familiar, I totally encourage you guys to maybe print the Universal Declaration of Human Rights and use that as a framework in your own work and recognize that not only is the United States held accountable to this document, but everyone who's a part of it. So like other nations, and just keep it there and appreciate it because it's already laid out. You just gotta follow it.
Thanks, Tiara. I wanna call everyone's attention to the chat. Jessica from Representative LaPointe's office has shared her comments and her strong support for the legislation we've been talking about, and want to say a particular thank you for sending over those co-sponsorship requests. We know that we are in the closing days of session, and we know that opportunities are dwindling, so continued support and generating that strong groundswell of support really helps raise these things as a priority. So we appreciate that very much. I'm going to call a last chance, going once, twice, for any other further questions or comments before turning it over to Jessica. We very much value your time. We know what a condensed session this is. We know how hard it was to find a time to do this. And even as we did so, we saw the committee hearings being added over the weekend. And so we know how many directions you all are pulled in. But we can't say enough how much we value the fact that you took some time to hear directly from those who you know, choose to be program participants for our services, some of us constituents, and some of us who provide these important services in your district. So thank you once again for doing that. I have a flag that I've got one more message, so forgive me, let me check that. It was a thank you. So you are very welcome. We look forward to doing these more often. So I'm going to turn it back over to Jessica to close us out.
As Anne said, and I will second, thank you all who joined us for this roundtable today, from our legislators to our participants, to our staff who spoke about the great work that we do and the impact that we have. And so after hearing the stories and perspectives of our participants and the empowering work of our staff, I'd like you to take 10 seconds to imagine an Illinois without human services. Imagine the pandemic without human services frontline staff. Now imagine that workforce full of mental health professionals, workforce development trainers, the domestic violence case managers, the mobile crisis response personnel on call. Now imagine the significant debt to obtain the education needed to be the accomplished human service professionals they are. These professionals stuck it out through the pandemic, choosing to remain and provide essential services to our communities and your districts. Illinois Partners and Illinois Collaboration on Youth have jointly filed legislation to create the Human Services Professional Loan Repayment Program. This program will provide loan repayment assistance to eligible direct staff professionals practicing in community-based human service organizations like Metropolitan through contract with or grant funded by state agency. By focusing this program on professionals working for community-based health and human service providers in Illinois, this bill seeks to improve employee retention, support for frontline workers, and create continuity in service delivery. Illinois has to address this human services workforce shortage. And we ask that you consider this legislation, SB 3925, currently in the Senate. And we ask that you reach out to your colleagues. We ask that you discuss this legislation in your caucuses to gain champions so that we can say thank you to those who have essentially held the state together and its people together by, it seems, through one of the most unprecedented times we've all experienced. Services Metropolitan Family provides and that the entire human sector provides depends on professionals who are skilled, qualified, and culturally responsive. We ask that you support these individuals who get up every morning and go to work to do the best for the communities that they serve and these communities which fall within your districts. We ask that you champion this legislation on behalf of those individuals. And for those who've participated, we'll be sure to share this legislation and all the other pieces of legislation that we included in this roundtable today with you all, so that you all can, if you've not already become a co-sponsor, sponsor this work, and you can get your colleagues and caucuses on board with championing this work. I'd like to thank everyone again for joining us. I'd also like to thank our task force, as Ann mentioned, our advocacy task force. This is one of their first roundtables, and the staff came together over the last few weeks and built this out under the guidance of Ann Vanderbilt, who I would also like to thank for leading and guiding everyone through this process for the success that we all experienced today. So thank you all once again, and happy Monday. And we ask that you enjoy the remainder of your week.
Thank you so much.